Welcome to the deep dive.
Yeah.
Today we're tackling a small but really powerful part of your body, the thyroid gland. It's this little butterfly-shaped thing in your neck, but wow, it runs so much your energy, even how your brain develops. And when it goes wrong, well, the effects are huge.
Absolutely huge and surprisingly widespread.
So today we're diving deep into thyroid disorders. We're looking at the underlying mechanisms, the pathophysiology, and how these issues actually show up in people. We've got some really detailed source material, almost like a medical text. But our job is to break it down for you, make it clear, make it stick, whether you're prepping for an exam or just curious.
Exactly. And I think the key thing to grasp right away is just how fundamental thyroid hormones are. They're involved in almost everything your body does at a basic level.
So understanding them is key to understanding the problems.
Precisely. You need to know the baseline before you can understand the deviation, Think of T3 and T4 as kind of the body's main on switch.
Okay, so let's start there. The baseline. What's the thyroid supposed to be doing? Our sources say the main hormones are T3, that's triiodothyronine, and T4, thyroxine, made by follicular cells.
That's right. And their number one job really is setting your basal metabolic rate.
Which means how fast your cells work, like burning calories.
Yeah, basically. It's the speed of everything. They do this by helping your body use carbs, fats, proteins more efficiently. This ramps up energy production, keeps your body temperature stable. It's like your internal thermostat and gas pedal rolled into one.
Okay, so controlling the body's engine speed. But you mentioned brain development.
Oh, absolutely critical, especially for the central nervous system, CNS, in the womb and in those first few years of life. Without enough thyroid hormone, then the brain it doesn't wire up correctly. It's quite profound.
Wow. And there's another hormone too, right? Calcitonin, from different cells.
Right, from the parafollicular cells or C cells. Calcitonin has a different job, though it's involved in calcium homeostasis.
How so?
Well, it basically puts the brakes on bone breakdown.
Oh.
It inhibits the cells called osteoclasts that normally resorb bone, so it helps keep calcium in your bones.
Interesting. So mostly metabolism and development from T3, T4, and calcium regulation from calcitonin.
Yeah, but focusing back on T3 and T4, knowing those core functions, like you said, metabolism, CNS development, that's what lets us predict the symptoms when things go wrong. It's like if the conductor speeds up or slows down, the whole orchestra sounds different, right?
Great analogy. And the problem isn't always the conductor, the thyroid itself, is it? Our sources talk about different levels of dysfunction.
Exactly. There's primary dysfunction. That means the problem is the thyroid gland itself. The conductor's having an issue.
Okay.
But then you can have secondary dysfunction. This time the issue is upstream at the pituitary gland. It might not be making the right amount of TSH, thyroid-stimulating hormone.
TSH is the signal to the thyroid.
Right. It tells the thyroid, hey, make more hormone or slow down. So if the TSH signal is wrong, the thyroid output will be wrong, even if the thyroid itself is healthy.
And there's even another level.
Yep, tertiary dysfunction. Now we're looking at the hypothalamus in the brain. It makes TRH, thyrotropin-releasing hormone, which tells the pituitary what to do about TSH. So a problem there affects the pituitary, which then affects the thyroid. Chain reaction.
Hypothalamus tells pituitary, pituitary tells thyroid. Okay?
Yeah.
And then there's one more, peripheral?
Yeah, peripheral or receptor level dysfunction. This is different again. Here, the hormones might be produced just fine, the signals are okay, but the body's tissues, they just don't respond properly. They're resistant.
Like the musicians ignoring the conductor.
Sort of, yeah. And figuring out which level is affected it's absolutely critical for diagnosis and treatment. You need to know where the fault lies to fix it effectively.
Makes sense.
Okay,
so we know what it should do and where things can go wrong. Let's talk about when it does too much. Hyperthyroidism.
Right. And first, a key distinction the sources make. Hyperthyroidism specifically means the thyroid gland itself is overactive, pumping out too much hormone.
Okay, gland overactivity.
Whereas thyrotoxicosis is broader. It's the clinical state, the symptoms you get from any source of excess thyroid hormone. Could be hyperthyroidism, could be taking too much medication, could be other things.
I see. So thyrotoxicosis, the result. Hyperthyroidism is one cause of that result.
Precisely. Helps narrow down the why.
So what are the main reasons the gland itself might go into overdrive? Primary hyperthyroidism causes.
The big one is Graves' disease. You might also hear it called Basedows disease. It's autoimmune.
Meaning the body attacks itself?
Yeah. In this case, the body makes these abnormal antibodies, TSH, receptor stimulating antibodies, or TSI, These antibodies basically mimic TSH, but the thyroid can't turn them off. They constantly stimulate the gland.
So it keeps making more and more hormone.
Exactly. And the gland often gets enlarged all over, what we call a diffuse toxic goiter. Another cause is a toxic adenoma that's like one specific lump or nodule in the thyroid that just goes rogue and starts overproducing hormone all by itself, ignoring normal controls.
Okay, so autoimmune attack or a rogue nodule. Are there outside causes too?
Definitely. You can get thyrotoxicosis from taking too much thyroid hormone medication. That's an exogenous cause. Also, sometimes exposure to large amounts of iodine, like in certain medical contrast dyes or the heart drug amiodarone, can trigger it. That's iodine-induced thyrotoxicosis.
And what about those higher level problems causing it?
Right. You can have secondary hyperthyroidism if, say, a pituitary adenoma, a non-cancerous tumor, makes too much TSH. That constantly pushes the thyroid,
Forcing it to overproduce.
And here's a really fascinating one. Certain trophoblastic diseases, like a hydatidiform mole during pregnancy or a type of cancer called choriocarcinoma, they produce a hormone called alapo-HCG.
The pregnancy hormone.
Yeah, and structurally, it's similar enough to TSH that high levels of it can actually activate the TSH receptors on the thyroid and cause hyperthyroidism.
Wow. So the thyroid can be tricked by a pregnancy hormone. That's wild.
The endocrine system is full of these weird overlaps.
Okay, so the body is basically stuck in overdrive. What does that feel like for someone? What are the symptoms, the clinical signs?
Think acceleration. Everything speeds up. Metabolically, people often lose weight even though they're eating more, sometimes much more. They feel hot, skin is often warm, moist, maybe flushed.
Makes sense, burning all that energy.
Exactly. Neuropsychiatrically, very common to see irritability, anxiety, trouble sleeping, insomnia, feeling hyper or agitated, maybe shaky hands, tremors. Your nerves are just firing on all cylinders.
And the gut.
Speeds up too. Increased gut motility, which often means diarrhea, sometimes problems absorbing nutrients.
Okay. What about the heart? That sounds serious.
It is. Very significant cardiovascular effects. Tachycardia, a fast heart rate, is common. Feeling your heart pound, palpitations, increased risk of arrhythmias, especially atrial fibrillation, which is a major risk factor for stroke. And in severe cases, the heart works so hard it can lead to high-output heart failure.
Wow. So heart, gut, nerves, metabolism.
Mm-hmm.
What else? Muscles, bones.
Yep. Muscles can feel weak, particularly the big ones around the shoulders and hips. That's proximal myopathy. Despite feeling hyper, people often feel profound fatigue too. And yes, tremors. Bones can suffer too. The increased metabolism speeds up bone turnover, leading to net bone loss, increasing the risk of osteoporosis.
And other hormones. Does it mess with those?
It can. It can affect glucose metabolism, sometimes leading to hyperinsulinemia as the body tries to cope with increased glucose absorption. And reproductive health can be impacted oligomenorrhea, irregular or infrequent periods in women, sometimes infertility or impotence in men.
It really affects almost everything.
It really does. It's a systemic overdrive. And recognizing these signs is so important because there's a potential really dangerous complication.
The thyroid storm.
Exactly. Thyrotoxic crisis or thyroid storm. This is a life-threatening emergency. It's an extreme worsening of the thyrotoxic state.
What triggers it?
Usually some major stressor on the body. Could be surgery, a bad infection, trauma, even childbirth, or sometimes those iodine-containing drugs we mentioned.
And what happens in a storm?
It's terrifying. Severe heart rhythm problems, hyperthermia, meaning dangerously high body temperature confusion, agitation, and potentially circulatory collapse. It needs immediate aggressive treatment in a hospital.
A true medical emergency. How is hyperthyroidism generally diagnosed then?
Usually the first clue is a blood test showing very low, often undetectable TSH, because the high T3, T4 levels tell the pituitary stop sending the signal.
Unless it's a pituitary problem causing it.
Exactly. In secondary or tertiary hyperthyroidism, TSH might be inappropriately normal or even high, but typically low TSH plus high T3 and T4 confirms it. Sometimes a TRH stimulation test is done, mainly to distinguish levels if it's unclear. No TSH response points towards pituitary hypothalamus issues, while an exaggerated response can suggest primary hyperthyroidism in some contexts.
Okay, that paints a clear picture of the too fast side. Now let's flip it. What happens when the thyroid slows down or stops working? Hypothyroidism.
The opposite picture, really. Everything slows down, and it looks quite different depending on whether it happens in childhood or adulthood.
Let's start with children. The sources mention cretinism, or congenital hypothyroidism.
Yes, and this is devastating if not caught early. It used to be common in areas with severe iodine deficiency that's endemic cretinism. Now, more often, we see sporadic cretinism.
What causes that?
Things like the thyroid gland just not developing agenesis, being too small, hypoplasia, or genetic defects, meaning the child can't make thyroid hormones properly.
And the consequences are severe because of that brain development link.
Absolutely critical. Untreated congenital hypothyroidism leads to severely impaired CNS development. This means significant intellectual disability, sometimes deaf mutism. There are also characteristic physical features, coarse facial features, a large tongue, macroglossia, delayed baby teeth, often an umbilical hernia, and overall growth retardation is a major sign.
Why the growth problems?
Because T3 and T4 are actually needed for the body to make and respond to growth hormone properly. So no thyroid hormone, poor growth. Also see delayed bone maturation, problems with sexual development later on.
Do they get a goiter too, and a large thyroid?
Sometimes, yes. If the thyroid is present but just can't make hormone, the pituitary keeps pumping out high levels of TSH trying to stimulate it, and that constant stimulation can make the gland grow larger.
It's really stark just how crucial thyroid hormone is in those early stages.
It truly is, and that's why newborn screening is so vital. A simple heel prick blood test can detect it. Treatment with thyroid hormone replacement can start immediately, and these children can develop completely normally. It's a huge public health success story.
That's incredible. Okay, so moving to adults, the term used is myxedema.
Right. Hypothyroidism in adults, it's more common as people get older, especially in women.
What are the causes in adults?
Historically, iodine deficiency was a big one worldwide, but less so now in many places due to iodized salt. Today, a very common cause is treatment for hyperthyroidism, like surgery or radioactive iodine ablation, which destroys the thyroid. But the number one cause of spontaneous hypothyroidism in adults where iodine is sufficient is Hashimoto's thyroiditis.
That's autoimmune again, but this time destroying the gland.
Exactly. It's a chronic autoimmune inflammation where immune cells infiltrate and gradually destroy the thyroid tissue. Central hypothyroidism problems with TSH or TRH production is much less common, but also a cause.
So what does myxedema actually mean? What's the pathology?
It refers to the accumulation of these complex sugar molecules, glycans, AGs, in various tissues, especially the skin, but also heart muscle, blood vessels. This accumulation is what causes the characteristic non-pitting edema, a kind of swelling that doesn't leave an indent when you press on it, because it's not just fluid.
Oh, okay. And the symptoms reflect that slowdown.
Absolutely. Everything is sluggish. People feel profound fatigue, lethargy, often gain weight despite maybe not eating more. They feel cold all the time, cold intolerance, get constipated. Mood changes are common too, depression, difficulty concentrating.
What about the heart and blood?
Cardiovascular system slows down. Bradycardia, slow heart rate, reduced cardiac output. That JAG infiltration in the heart muscle can make it stiff, leading to restrictive cardiomyopathy. Hematologically, they often develop normocytic anemia, basically. Red blood cell production slows down too.
And other endocrine effects.
Yes, it can cause hyperprolactinemia, high prolactin levels, which might lead to infertility or even milk production, galactorrhea. It can also suppress FSH and LH, further impacting fertility and cycles. It's a systemic slowing, just like hyperthyroidism was a systemic speeding up.
And just like hyperthyroidism has thyroid storm, is there a crisis state for hypothyroidism?
Yes, myxedema coma. This is severe decompensated hypothyroidism. It's another medical emergency.
What are the features?
Profound hypothermia, dangerously low body temperature, extreme bradycardia, low blood pressure, confusion or coma, and potentially cardiovascular collapse. Needs urgent treatment, usually in intensive care.
Another critical situation. How's adult hypothyroidism typically diagnosed?
The hallmark is usually a high TSH level because the pituitary is shouting at the underactive thyroid to work harder, and you'll see low T3 and T4 levels. Again, if it's central hypothyroidism, TSH might be low or inappropriately normal, but that's rarer. The TRH stimulation test can again help differentiate primary thyroid from central pituitary hypothalamus causes if needed.
Okay, so we've covered too fast and too slow. What about just enlarged? Let's talk about goiter or struma. You mentioned it briefly.
Right. And the key thing here is that goiter just means the thyroid gland is enlarged. That's it. It doesn't automatically tell you if it's overactive, underactive, or working normally.
So you can have a goiter and have normal hormone levels.
Absolutely. We classify goiters based on function. Hyperfunctional, like in Graves' disease, hypofunctional, like sometimes in Hashimoto's, or eufunctional, meaning hormone levels are normal. You might see eufunctional goiters during times of increased demand, like puberty or pregnancy.
And they can look different too. Diffuse versus nodular.
Exactly. Diffuse means the whole gland is smoothly enlarged. Nodular means there are distinct lumps or nodules within the gland. And we also classify by cause hyperplastic, like the gland growing in response to high TSH or lack of iodine, inflammatory, like Hashimoto's, or negoplastic, meaning tumors, which could be benign or malignant.
So seeing a goiter is a sign something's up with the thyroid, but you need more tests, blood tests, imaging, maybe biopsy to figure out what exactly.
Precisely. It's a physical finding that prompts further investigation.
Okay, let's quickly recap some specific conditions we've touched on, pulling it together. Graves' disease.
Autoimmune hyperthyroidism, caused by those TSH receptor-stimulating antibodies, often see the triad, thyrotoxicosis, exophthalmos, the bulging eyes, thyroid eye disease, and sometimes pretibial myxedema, that jag buildup on the shins.
Hashimoto's thyroiditis.
Chronic autoimmune destruction. Lymphocytes invade, follicles get destroyed, leads to progressive hypothyroidism, very common cause of goiter with hypothyroidism.
Colored nodular goiter.
That's an enlarged gland with multiple nodules, often euthyroid, so normal function, thought to be caused by long-term TSH stimulation, maybe cycles of growth and regression.
And thyroid neoplasms.
Thyroid tumors. Most common are adenomas, usually benign, sometimes functional, and then cancers. A key one the sources mention is medullary thyroid carcinoma.
Right, because it's different. It comes from the parafollicular C cells, not the main follicular cells.
Yeah.
And makes calcitonin, which we can measure in the blood as a tumor marker. It really shows how these specific diseases are just manifestations of those broader principles of thyroid function and dysfunction we've been discussing.
So what does this all mean for you, the listener? Well, we've covered a huge amount today, haven't we? From how these tiny hormones, T3 and T4, run your body's engine and wire your brain, to the really dramatic ways things can change with too much hormone in hyperthyroidism or too little in hypothyroidism. It really hammers home how this small gland influences almost everything. It really does. And what I find fascinating, connecting this maybe to the bigger picture, is how this single gland orchestrates such profound, diverse effects. Understanding these pathways isn't just about diagnosing disease, although that's obviously critical. It also gives you a deeper appreciation for the incredible, delicate balance required to keep us functioning well.
So it's about appreciating that profound impact, right? This small gland, big job. Maybe the next time you think about your energy or warmth or focus, you can give a little nod to your thyroid, running that complex symphony inside you every single day.